I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease, and you're going to create the webinar with your questions. So as usual, I'm very interested in seeing what you have in store for me tonight. I see a number of familiar names on my message board, and I see some new people too. So to both groups, welcome here. For those of you that are participating the first time, there's a couple of ways you can participate, and even those that are participating again. But this is for those that have been here before, know the routine. But for those of you that are new, there's two ways to participate. Number one, you can be bold and actually write a question to me, right? And where you do that, there's a chat box on the lower, I believe, right-hand side of your computer where you can write a question to me. Just be aware that as you write that question, do not hit the enter key until your whole question is written. Each time you hit that enter key, unfortunately, it sends a part of your question to me. So just write your question as a long run-on, okay? And then if, the other way to participate here is to see what questions I take from other people and see the responses that I give for those questions as well, too. If you are participating in the live version of the webinar, which those of you that are here right now are, but I also record this too. But if you're participating in the live version, you'll actually be able to see the questions. I'll post them on your screen and you can read them, but they don't show up in the recorded version. So therefore, I will be reading them out loud as we get to that too. All right. So as I mentioned already, I do create a recording of these, and 99.99% of the time that recording goes as planned. My job after we get done with the webinar tonight is going to be to do a quick edit on that video, and then between now and 9:30 or so in the morning Austin time, I will create a summary of that, of the recording, and send an email out to you announcing that it's ready. When you get that email, you also have an opportunity to sign up for next week's webinar too. So we have two more left in this month. So we have today, and then we have next week, and then I'll be off for a week, and we'll be doing the webinar the week after that. All right. So I think we've covered about all the major stuff here. Why don't we go ahead and get started here? Hello, John. Let's see. Hello, Dr. Ross. I started your azithromycin plus fluconazole protocol for Bartonella 90 days ago, slowly adding Japanese knotweed tincture because I cannot tolerate cinnamon or clove. I felt a little better at the beginning, and my symptoms started getting more intense, rotating various pain in feet, ribs, muscles, joints, improved a bit again around 60 days, but now at 90 days, the foot, muscle, and joint pain is flaring again. Tried increasing the curcumin. Sometimes it helps a little, but not much. Planning to stick with it, wondering, is this progression is similar to what you saw in your patients? Should I consider adding Lumbrokinase at this point, or would you recommend other adjustments? All right. So, John, so everyone, what John's describing here is there's a regimen. One of the regimens I recommend for treating Bartonella is to use fluconazole, which is actually generally used to treat yeast. But the azole family that is in has some laboratory evidence showing that it's great treating both growing forms of Bartonella and what are known as persister or hibernating forms of Bartonella. All right. And so many of you may be familiar with the concept, but we now realize that the majority of germs are not growing, are growing, but then there's a small percentage that hibernates, and those hibernators do not respond to the classic antibiotics, either herbal or prescriptions that we use, all right? So fluconazole, I found in my practice, provided a lot of promise for people. I was getting a lot of great improvements on that. And coupling it with azithromycin, it's helpful. Azithromycin only treats growing Bartonella inside your cells, but it's helpful in this regimen. And then in addition, I like using another persister agent that will also go against growing forms. And Japanese knotweed, the herb Japanese knotweed, can do that. It can go after both growing and persister forms of Bartonella. The only thing that and so John has decided to use that instead of the cinnamon clove oregano combination I recommend. That regimen also treats growing and persister Bartonella, but it has one added advantage in that it does also treat and remove biofilms. And it can also, Yeah, so that's the big one. Okay, so he doesn't have as good of what I will call biofilm coverage. Biofilms are slime layers that grow over germs, and they can block out your immune system from getting at the germ, and also herbal or prescription antibiotics from getting there. Okay. Now, it is true as you start a new regimen, sometimes you're going to see worsening as a result of Herxheimer reaction. So Herxheimer reaction is a killing reaction where your immune system sees all the dead bug parts that you're killing, and it releases a bunch of inflammatory chemicals called cytokines, and those cytokines make you feel worse, okay? But typically, your flare from a Herxheimer is only going to be when you first introduce the antibiotics. It isn't going to keep going on for up to 90 days. Okay, so I just have to say that, all right? So it makes me wonder two things here. So, and then first of all, John also recognized that maybe this could be a Herx, decided to increase his curcumin. Curcumin is one of the couple or a few number of supplements we can use that actually will limit cytokine production, and that did not help as well. Okay, so when we get to a point like this, there's a couple things I have to wonder. One is this treatment actually even working? Okay, so you have to wonder that. Okay, the other thing that you can wonder is, in addition to having your Bartonella, sometimes when you're on prescription antibiotics and herbal antibiotics, it triggers too many yeast to start growing in the intestines. Now, I have to say that's kind of a remote chance of happening here, because the fluconazole you're using for Bartonella would limit the ability for you to make yeast, but it is still possible, okay? So whenever somebody is not doing well, you have to kind of go through a framework of things you'll look at, all right? One is the treatment working? All right. The other is there something else going on that's flaring up these inflammatory cytokines? And the cytokines I mentioned already will flare during a Herxheimer reaction, but they'll also flare if you have something else triggering the immune system to make cytokines. And so the other things that can cause the immune system to make cytokines are having tick-borne infections, all right, having COVID, having too many yeast growing in your intestines, and mold toxicity. Those are the things that can trigger more cytokines. The classic thing that can do it in a treatment, though, is being on your herbal antibiotics and prescription antibiotics and having more yeast grow. And it can even happen while you're on fluconazole, because yeast sometimes do learn resistance to fluconazole, all right? So, and looking at, could this be too many yeast that's leading to this, John? I think you know the routine I'm going to go through here in a minute, but you got to figure out, do you have enough symptoms that suggest yeast? Okay, so one is, do you have increased sugar cravings? Second is, do you feel a lot worse after having sugar? Do you get more fatigued, more achy almost pretty quickly right after doing that? Okay. The other one is, are you gassy or bloated quite a bit? Another one is, sometimes those yeast that grow too much in your intestines release toxins that will interact with your skin, leading to more pimples and acne or worsening of your eczema. Okay. So if you heard my questions and it sounds like you have too many yeast, well, then you need to figure out with your physician, how are you going to go after too many yeast while you're on fluconazole, all right? And what I would suggest is a simple way of fixing this, if it is too many yeast, is to substitute out the fluconazole for its brother or sister that is stronger at going after yeast, even if the yeast have learned resistance to fluconazole, and that is something called Itraconazole, also known as Sporanax. All right, so John, as I went through all these questions, if you thought to yourself, sounds like I might have too many yeast, in that case, pull the fluconazole out and try Itraconazole, okay? And an Itraconazole dosing that can work for yeast is 100 milligrams twice a day. And because it is an azole, it should also help with growing and persister Bartonella as well too. All right. Now, if for some reason you've determined that this regimen just isn't working, it's not yeast, you're worse for another reason, then you got to go back and change up what you're using. And unfortunately, for me to figure out what to recommend for you to change to, I would need to have a better idea of what you were on before, where you came from. Okay. So unfortunately, I can't tell you what's the next best thing to do here. For instance, you could build a treatment around methylene blue, for instance. Methylene blue would have to be made by a compounding pharmacy, but it's very active against growing and persister Bartonella. It couples very nicely with azithromycin, and you could still use your Japanese knotweed there as well too. All right. Now you mentioned, should you add in Lumbrokinase at this point? And it is true that if you add Lumbrokinase in, you get some help with breaking up biofilm. You also get some help with taking care of another issue that will limit treatments moving forward. And that is Bartonella has the ability to wrap itself up in your blood clotting protein called fibrin. And basically it hides within these fibrin nest, and that can block treatment too. The reason I'm not suggesting you go for biofilm and you necessarily look at this as a fibrin nest problem is that basically you've had just this gradual steady decline over 90 days with some ups and downs, but it's been a progressive decline that happened since you've been on treatment. And that is more suggestive of the treatment failing or yeast moving in than it is fibrin nest blocking treatment and biofilm blocking treatment. Okay. All right. That's a lot of stuff there. I hope they gave you some information to look at there. Everyone, I'm going to do a quick screen share here because I said a number of things that might be helpful for you all. Take a look at it if you want to look at it more later. Okay. So let me just turn on my screen here. All right. So first of all, in terms of Bartonella regimens that I recommend, that I have written about, take a look at this article called Kills Bartonella, Brief Guide. All right. And in here, you're going to see information about the biofilms and fibrin nests. And I do address that, yeah, you probably do need to do something about those. But again, your pattern of your decline is more suggestive to me of either yeast or the treatment not working, okay? But any other major ways that I suggest treating would be to do a fluconazole-based treatment, okay? And again, you could substitute itraconazole for the fluconazole, or you could do a rifamycin-based treatment, or you can do a methylene blue-based treatment. So there's a variety of ways that you can do that, okay? And then for those of you that are not familiar with methylene blue, let's see, I have a whole article on methylene blue. I thought I had it in there. Let's go back here. So I have a whole article on methylene blue. And this is it, where I talk about methylene blue. I talk about how it needs to be compounded. I talk about how it can work for both Lyme and for Bartonella. So that's another option to look at. And then I'm just going to show you one other thing too. For those of you that are primarily building herbal antibiotic regimens, I did an article here. So there's an article that I came up with probably a couple months ago now that is basically looks at all the variety of herbal antibiotic only regimens you can do that will deal with growing and persister Lyme and Bartonella, growing and persister or not, and then also Babesia. Babesia doesn't have persisters, but there's a whole host of options that you can look at. And I grew it up into a table that describes what works for persisters, what works for growing, what works for even biofilm is addressed within this table as well too. Okay. All right. Good luck to you, John. Hello, Blakely. Let's see. Which infection really sets up in the skin, perioral dermatitis, and the beard area, and eczema and psoriasis on top of the head with rapid skin development that when I wash any of this, I herx and I feel exhausted the next day. Small pencil eraser size rashes that burn and exude clear yellow fluid. And even on my own skin, oil feels like it's burning and it will tarnish my jewelry quickly. I was bit by a feral cat, so scabies, tularemia, and other bizarre things are not out of the question. Thanks. All right. So where I would start, Blakely, is to look at, do you have too many yeast in your intestines? As I mentioned earlier to John, when we were talking about his situation, as I said, one of the symptoms that can suggest too many yeast is having a lot of pimples or acne, or worsening skin issues, okay? And so those skin issues can look like worsening of your eczema, worsening of psoriasis, worsening of something called seborrhea dermatitis, which is dandruff. You can also get seborrhea dermatitis here in the folds of your nose, up here in your beard. You can have scaly, flaky, raw areas in your beard. That's seborrhea dermatitis, okay? And so that's where I would start. I would look and see, do you have too many yeast? And I reviewed earlier questions you could look at. There's also a detailed questionnaire. I'll show you an article that you can look at, all right? If there's a possibility you have too many yeast, even if you have other underlying problems, take care of the yeast first, all right? Because often that will result in most of your skin issues clearing up, all right? Now, why is it that this happens? As I mentioned, one is the toxins interact with the skin, but also we now know more and more about this thing called the gut microbiome and its relatedness to all kinds of organs in our body. Okay, so you have the gut microbiome brain axis, you have the gut microbiome immune system axis, you have the gut microbiome skin axis. Okay, so what happens in the gut directs the rest of your body and its organs and organ systems to work correctly. And if you get an imbalance of the good microbiome, the good bacteria, the good yeast that normally live there, healthy yeast, not candida yeast, viruses or parasites that normally live there, if they become imbalanced, you're going to have problems with your skin because the gut isn't going to be directing the skin correctly. Okay, that can happen. So that's an idea for you, all right? All right, so let me just do a screen share. I'm going to point out a couple articles to you. Okay, and no, that is not what's going on with your skin. Is generally not part of what we would see being caused by Bartonella, Borrelia, or any of the other tick-borne infections. Okay, all right. So take a look. Take a look in my chapter called Yeast. And in here, read this article. It describes how do you diagnose and how do you make a decision if you have too many yeast, okay? Then also there's an article I have about how do you take care of yeast if you have too many yeast, okay? All right, so take a look at that. And then in terms of the gut microbiome, I would take a look at this article. Here it is. So there's to read more about the gut and all the things that it does in the body and how you maintain health of your intestines on or off antimicrobials. Take a look at this article. It's a very comprehensive article. It's a little bit long. And because it's long, I actually created a PDF version you can download and read. But this will give you a lot of information about how the gut and what goes on in the gut reflects on the rest of the body and controls the rest of the body as well. Okay. Good luck to you, Blakely. Oh, Blakely, there is one other condition I will mention. You may have run across it. I'll put your question back up. There's a condition that can be triggered by the 3 Bs called Morgellons, which is usually described as non-healing sores on the skin. but it's a little different than what you just related. You're relating something different than that to me, but I just wanted to point that out to you as well too. Okay. All right. Good luck to you. Hello, Colleen. Let's see. Started taking Ferrisorb this week to address low ferritin levels at 13. Is there anything I'll need to be mindful of while taking, especially wondering about it containing high levels of B12? What testing should be helpful to track things while taking this to try to get my ferritin levels to a healthier level? Thank you so much for all of your help and for all of us. So, Colleen, you're not going to get too much B12. You can have high levels of B12 and there's no harm from that. I just want you to know that, okay? The Ferrisorb is generally meant to address any nutrient deficiency that would result in low blood cell counts, okay? But I also like it because it's the best way I've found to raise ferritin levels, all right? So what I would do is in a month after you started taking it, go ahead and have your doctors recheck your ferritin level to see if you're budging that as an indicator of what your iron levels are in your body, all right? So everyone, when you're trying to assess whether you have enough iron, one of the tests you can do is to measure this test called a ferritin. And ferritin is the storage form of iron, and it's most reflective of whether you have enough iron in you or whether you have too much or too little, right? Now, if you have too little iron in you, you may have fatigue because iron is used as a cofactor, a chemical for a lot of the chemical reactions that generate energy for us, okay? But the bigger thing that people will have if they start having low iron, even before they have low enough iron to get anemia, is they'll start experiencing hair loss. And we find that hair loss occurs at about a level of 40 or below, right? So the target with below 40, I should say. The target with treatment is to get your ferritin level above 40 if you're treating for hair loss on that low ferritin level, okay? All right. Good luck to you, Colleen. Hello, TJ. Let's see. Do you know what infection likes to hang out in the L5 vertebrae? I have this problem, but I've gone to a Lyme support group, and it seems like a very common thing. I've heard Borrelia. I've heard herpes. Type 6. Also, do you think that chicken or the egg on the other common thing, which is infected tooth, is that Lyme goes into the tooth or tooth pollutes the blood with infection? Thanks. All right. So there is not a specific tick-borne infection or a specific viral infection that targets the L5 vertebrae, okay? I just want you to know that. Now, that's not to say that Borrelia, which can give you a lot of inflammation within the various joints in the body, won't be affecting the L4, L5 joint or the L5S1 joint. And the reason I use those two numbers is there's an L4, the fourth lumbar vertebrae, 5 is the fifth lumbar vertebrae, and they sit on top of each other. And then they have side arms that come out that provide a joint, okay? Those joints can get inflamed and make it feel you got pain coming from the vertebrae, but it's usually because you got pain, you got inflammation in the joints. Borrelia can give you that inflammation in the joints, all right? I have not seen HHV6 lead to inflammation within joints or give you arthritic changes. Okay, I just have not seen that happen, all right? The other thing that can happen that may be giving you pain in that area is if you don't have inflammation in the joints triggered by Borrelia, is if you've developed inflammation of the nerve roots that come out of the back between the two bones at that level, you will feel pain in that area. And the two infections that can lead to inflammation of the nerve roots are Bartonella and Borrelia. The only way to know if you have inflammation of the nerve roots there would be to get an MRI. An MRI also could get a good look at the disc and get a good look at your joints and help you decide if you've got inflammation within those joints as well too. But to answer your question, there's not a specific infection that targets the bone, the vertebrae itself, you're usually talking more either pain coming from inflamed nerve roots, or you're talking from inflammation within the joints in that area as well too. Okay. And then as far as infection spreading for your tooth, basically it wouldn't spread from your tooth necessarily. Keep in mind, whenever you have Lyme in you, although you may have more symptoms related, I should say Borrelia, Lyme, and Bartonella, any of the tick-borne infections, although you may have symptoms that may affect one certain area of your body, those germs have already spread completely throughout your body. They're not limited to infecting just one small area, basically. Okay? All right. Good luck to you, TJ. Hello, Damien. Let's see. Hello, Dr. Ross. Do any of the 3Bs or mold toxicity cause hypertension? I can't seem to get my blood pressure down, even with medication and lifestyle modifications. I have not seen that. I have treated tick-borne infections for over 20 years, thousands of people, and I have not seen anyone in my practice develop hypertension that was related to the infection. So I'm not saying it couldn't happen. I'm saying it's not a common thing. Okay. All right. Good luck to you. Oh, the only thing I would look at though is, and I'm sure your doctors, if you're having a hard time doing this, they should have looked to see that your kidneys are working well. They should have, if they're having a hard time getting under control, they might even want to make sure that you've got adequate blood flow to your kidneys, that you don't have something restricting blood flow to the kidneys. They should be doing testing to figure out why you're having such a hard time getting this under control, testing that you would do in anyone that doesn't have tick-borne infections. Okay. All right. The one thing to keep in mind, sometimes some of the medications we use can interfere with kidney function, which could drive your blood pressure up. So your tetracycline sometimes can lead to a kidney injury, although that would be showing up on a kidney blood test. That injury would show up as problems on a kidney blood test. Okay. There are other antibiotics we use that may interfere with how the kidneys function as well too. But again, that would show up as an abnormal creatinine or BUN level on your kidney blood testing. Okay. All right. Good luck to you. Hello, Carter. Let's see. Also, what specifically sets up at the atlas and orbitals around the back of the head and neck, causing significant debilitation? I'm not even comfortable driving anymore. It's like cranial instability. I have even noticed that I'm mouth breathing, which I never did before. Okay. So of the infections, Borrelia can lead to a lot of symptoms in the neck region. Okay. But any of the tick-borne infections can lead to laxity or looseness of the tissue connections that hold your joints together. All right. So you can get into instability of the joints due to that. That kind of problem that you're having, usually you want to take care of your tick-borne infections, whatever they are. Okay, that will help. But you also should get a physical therapist evaluation for cervical instability, and possibly getting into some physical therapy to help gain that stability back again. And sometimes you even have to have different braces while you're going through treatment until that instability settles down. Okay. All right. Good luck to you, Carter. Hello, Laura. Let's see. Hi, Dr. Ross. Can you please clarify the differences between NAC and NAD? Are they safe to use in IV form, even for sensitive patients? Thank you as always, Laura. All right. You're welcome. So NAC stands for N-acetylcysteine, which is a different chemical than I'll just call it NAD for short. I'm blanking on what the actual initials stand for there. Okay. NAC is an antioxidant, and it is a building block for the master antioxidant in our body called glutathione. All right. So if you take NAC, it eventually leads to greater production of glutathione, which can help as an antioxidant. Glutathione also helps lower cytokines. And so it's a way of building glutathione. Okay. All right. NAD is a chemical that is used within your cell energy factories called mitochondria to help carry electrons around in a process called oxidative phosphorylation. And in some people, that process is impaired badly enough that you need to take NAD to help it. Now, I think there's other ways to get your mitochondria working better than using NAD, but that is one of the things that NAD can do. And the best way to get that in you would be in an IV formulation to do that. Now, as a sensitive patient, I would be careful with anything you take, right? So even NAC, which is a very strong antioxidant that can eventually help with detoxification, if you're sensitive, I would want to go low and slow. I would also give you that same advice about the NAD as well, too. Okay? All right. Good luck to you, Laura. Hello, Michelle. So do you think substituting itraconazole instead of fluconazole and with your suggesting treatment plan for Bartonella would be just as effective? My daughter can't tolerate fluconazole, but can itraconazole. Thank you for all you do. Yeah. So as I mentioned earlier with John's question with the first one of the night, and I realized that you probably wrote this question earlier before I took John's question, but so as an azole, so fluconazole is an azole, itraconazole is an azole, and both any of the azoles can be effective at helping with Bartonella. And so, yeah, I have a number of patients I treated, instead of using fluconazole as part of their Bartonella treatment, I used itraconazole as part of their Bartonella treatment. Okay? All right. So good luck. Good luck to your daughter, I should say. Hello, Deborah. Let's see. Any suggestions for long COVID? It has affected my vision, in particular with visual snow and darkness. It still fluctuates. It seems new ringing in the ears goes with it. But my main concern is the darkness. Thanks. I had it 1 year ago and have Lyme over 10 years. All right. So, Deborah, treating long COVID is complicated. All right. I'm going to show you in a second a protocol I have that addresses about 8 different things that we think build together to give you problems like long COVID. All right. It's a very extensive protocol, and it's something you probably ought to bring to your physician and see which parts or maybe all of the parts that you should do for you. I can't tell you out of the protocol what's going to be best for you because I would need to spend more time talking with you to get a better sense of the various symptom problems you're having, in addition to the visual snow and the darkness and the neurologic symptoms that you're having. Okay. So let me, and I'm sorry if you may have a hard time even reading this given the visual snow problems you're having, but I can't in this format ask you a bunch of questions. I need you to clarify what's the best way to go for you. All right. So let me just show you the protocol instead. Okay. All right, so in terms of, I think I parked it under infection treatment plans here. Yeah, there it is. So it's called Solving the Puzzle, the Ross Long COVID Support Protocol, okay? And briefly, I'm just going to kind of walk you through some of the steps that it deals with. This is based on some research out there as well, too, okay? But basically, in looking at long COVID, I'm trying to get down to the steps here. We recognize things that may be beneficial. Some of those are eating a plant-based diet, getting sleep, getting movement going as best as you can, modifying stress, and connecting socially. Okay. The second thing we're realizing that for some people, there may be viral persistence, just like Lyme can have persistence. You can have viral persistence here. When this protocol was developed, at that time, there was the access to something called Gromwell root. That was a product that had been developed by the Israelis that seemed to be doing really good at helping potentially getting COVID levels down, but that no longer is available. And so some people are advocating using courses of Paxlovid or even ivermectin to decrease your germ load, okay? This part you would need definitely to have a provider involved with you on it, okay? Second thing we like to do is to repair damage creating to your blood vessel linings and your organ linings through these ACE2 receptors where the COVID can get in there. And I lay out a couple things you might want to consider doing to do that, okay? The next thing that is out of whack when people have long COVID, and this is one of the primary problems in long COVID, is you get a lot of interruption of the good intestinal microbiome. The balance of healthy bacteria there gets totally destroyed in some ways, okay? So you have to rebuild it, and I talk about how you do that here, all right? There also is chronic inflammation that needs to be addressed, and I talk about some ways to do that here. I talk also about fixing the mitochondria that can get injured during long COVID. I talk about how to do that here. And then we recognize that there may be depletion of serotonin, which is one of the main neurotransmitters in your brain. And I talk about how you can deal with that here. And then finally, there's immune system dysregulation, and I give you some ideas about what you can do to address that here. Okay, so it is not just an issue of taking one thing. That's the main thing I want to let you know. Even if you primarily are having neurologic symptoms, it's going to require a number of facets of coming together. And given the complexity, you need to get an integrative medicine doctor or somebody that's at least skilled in treating persistent infections like Lyme disease that can help walk you through what's going to be appropriate for you on that. Okay? All right. Good luck to you. Hello, Margaret. Let's see. I've twice tried a biofilm buster. First, Biofilm X, and second, Biodisrupt by Research Nutritionals. In both cases, I took one pill, and within an hour, I exploded with uncontrollable vomiting to the point where I passed out. It was mostly biofilm I vomited. What on earth went wrong? Boy, I don't know. I honestly don't know. The Research Nutritionals and Biodisrupt has a number of components, I should say, or supplements that are in it. Biofilm X, let me see if I can find that product. I don't know that product off the top of my head. Let me do a screen share and we'll look at it together here. Oops, I guess I messed that up. Let's try that again. I guess I didn't share. There we go. All right. And then, okay, so you said Biofilm X. Oh, there it is. Biofilm X. It's got serapeptase, protease. It's got a bunch of enzymes in it. Yeah. All right. So the problem is, in trying to figure out what you reacted to, is that Biofilm X, as well as the Research Nutritionals product called Biodisrupt, have multiple components. And one of the, and so my preference in my own practice, even though I've worked with a number of these products like the Biodisrupt, my preference usually is to use single component herbs so that if something goes wrong, I can figure out what the heck it was. All right. I will tell you a commonality between that Biofilm X, though, and a commonality with the Biodisrupt is both of them have a lot of enzymes in them. Biodisrupt has a number of things that are not enzymes, though, as well, too. All right. So one thing you might want to look at trying is, so I think you've reacted to the enzymes. I don't know why you did, okay? There is a rule that I have in medicine, and some of you may have heard this one before through the webinars, but generally my rule is anything can happen to anyone with anything. All right, so we all have peculiar side effects that are very unique to us, all right? So I don't know why you reacted, but when I look at those two products, what I see is a lot of enzymes and a lot of enzymes, all right? So anything that ends in the words ASE is an enzyme, all right? All right. And that Biofilm X was primarily enzymes. The BioDisrupt has some enzymes in it, all right? So what I would suggest, if you're going to wind up trying something else for biofilms, to try to stay away from products that have enzymes in them, all right? And one of the products that does not have enzymes in it, but regrettably it has a number of components, is a product called Biocidin. And let me show you what's in that here real quick. Let's see. All right, so this is my store. And as you know, I carry products here that I have found useful in my practice when I was still practicing. It is available to anyone. Anyone can buy here. Before I show you the Biocidin product, just so you know, anyone can buy here. And there's reasons to buy from me. Number one, I try to pick really good quality stuff, okay? So I take the guesswork out of it for you. Number two, we ship free for orders over $50. Number three, if you're in an area of the country where you would have to pay taxes, I cover those taxes. And number four, we ship fast. Anything that comes into my fulfillment center in Austin, Texas, and arrives before 2 p.m. Monday to Friday ships out the same day, okay? And you know that's almost 100%, okay? So those are reasons to think about purchasing here, all right? But let me just show you. So the Biocidin, okay, so this is Biocidin. It comes in a few different formulations, or it comes in capsules, comes in a liquid, and comes in a liposomal variety as well too. All right. If you're trying to break up Lyme biofilms, Bartonella biofilms, you want to do the liposomal variety because it will get absorbed into your bloodstream. All right. The non-liposomal variety, like the drops and the capsules, will tend to stay more in the intestines. Some will get absorbed into the bloodstream, but these will tend to stay more in the intestines. All right. All right, so what is the base formula, whether you're using the drops, the capsules, or the, well, I think I'll go over here. That's too small. So the key ingredients that are in the Biocidin, you've got a mix of bilberry, grapeseed extract, shiitake mushrooms, golden sea root, noni fruit, garlic bulb, white willow bark, milk thistle seed, raspberry fruit, echinacea, black walnut, lavender oil, oregano oil, galbanum oil, tea tree oil, fumitory, and gentian lutea root. Okay, so multiple herbal components, but there are no enzymes in here. All right, and there is good research that Biocidin Botanicals has done looking at their product and what it can do against biofilms, and it's actually quite effective. It seems to break down Lyme biofilms. It can help prevent them from forming, can help keep them from spreading as well too. And so this is another option for you to consider, because but the reason I'm choosing this is it doesn't have any of those enzymes that were in the other products that you reacted to, all right? Given the type of reactions you've had, though, I would suggest strongly you talk to a provider before you start something like a Biocidin, though, okay? All right. All right. Good luck to you, Margaret. Hello, Sheila. Hi, Dr. Ross. I've had Lyme for 4 years. I'm currently with an LLMD and was prescribed low-dose naltrexone, nystatin, doxy, azithromycin, and hydroxychloroquine. He wants me on them together for 3 months, starting with the first antibiotic and adding a new one every week or so as tolerated. So far, after about 4 weeks, I'm still just on the nystatin, doxy, and azithromycin. He has given me supportive supplements like glutathione, etc. I feel crummy. How do I know when it is a Herx and what is from antibiotics? I have nausea, headache, some muscle aches, and face flushing. I still need to add the last antibiotic, but boy, it's hard to keep going feeling so miserable. Have you used this combo before or found it to be successful? All right. So in terms of trying to figure out, so when you feel like crap, there's a few things behind it, okay? Number one, just having tick-borne illnesses, you're going to feel like crap, all right? And the main reason you feel like crap with tick-borne infections is the immune system and trying to get rid of these infections. Once it sees these infections, the white blood cells are going to manufacture a bunch of chemicals called cytokines, all right? Now, cytokines are good and bad. On the good side, cytokines help turn the immune system on by causing more white blood cells to be made, drawing the white blood cells to where that infection is, and helping the white blood cells work better. Okay, that's all good. We want that, all right? But the trouble is in tick-borne infections is that the immune system often does not work well at getting rid of these problems. And so it tries harder and harder, and eventually it makes too many cytokines, all right? And too many cytokines or excess cytokines lead to poor thinking, fatigue, insomnia, body pain, joint pain, neurologic dysfunction, hormonal dysfunction, etc. All right. So Lyme's disease symptoms, tick-borne infection symptoms are really a large part of those are excess cytokine symptoms. All right. Now, and so usually when you start killing germs, what is going to get worse is your underlying symptoms, because as you start killing germs, you're going to trigger something called a Herxheimer reaction. And in a Herxheimer reaction, the immune system sees the dead bug parts, and it will react by making more cytokines. So your underlying excess cytokine symptoms will be the things that get worse. All right. Sorry. Now I'm trying to make a distinction about that, because it is also true that doxycycline, azithromycin, nystatin, and even low-dose naltrexone sometimes can have side effects, all right? So nystatin sometimes gives nausea. Doxy often gives nausea. Azithromycin can cause ringing in the ears, sometimes can give you dizziness, and sometimes gives nausea, all right? You see where I'm going here? So in trying to determine, are you having side effects or are you having a Herx, look and see what your initial underlying symptoms were. And if you have new symptoms, those are probably side effects, all right? And you should be talking to your provider, writing them, talking to them, and figuring out and letting them know how bad you're feeling and that it seems different than before, and get some ideas on what they want you to do, all right? So part of this maybe you need to stop something, all right? I can't say for sure because I don't get to ask you all about your symptoms before and now, all right? I can tell you if you didn't have nausea before, though, that is likely a side effect of either the doxy or the azithromycin. One of the things I want you to know is doxycycline is notorious for causing nausea. One of the ways around the doxycycline nausea is to take it with food, even though the pharmacist put a big label on your bottle and said, take on an empty stomach. You can ignore them, all right? So the reason they put that on there is they're concerned you're going to get decreased absorption of the doxycycline. But the issue isn't all food, it's high calcium food, all right? And what is high calcium food is milk products and dairy substitutes like soy milk, rice milk, coconut milk. They all have calcium added to them as well too, all right? So if you could avoid the dairy substitute, milk substitute products, you can still eat, just don't have dairy at the same time. That may go a long way towards taking care of some of your nausea if that is coming as a side effect, okay? Now, if you had headaches and muscle aches before and face flushing, now those are pretty common excess cytokine symptoms. So if those have gotten worse, that suggests an excess cytokine problem, all right? So the things to do for excess cytokines are the glutathione that your provider has you on. It can be helpful. And I usually recommend anywhere from 400 to 500 milligrams one time a day. And if that's not holding you well enough, then going up to twice a day. In addition to control cytokines, I like to have people take curcumin. I like using a liposomal variety of curcumin, which is called curcumin phytosome by Thorne. And that's 500 milligrams 3 times a day. An alternative to doing that is to take a product by Research Nutritionals called Cytoquel. Cytoquel also has some curcumin in it, but it also has a number of other herbs that interfere with cytokine production in your white blood cells. Like it's got some black tea extract, it's got some quercetin in it, it's got a number of other things in it as well too, all right? And I'm not sure what your provider has you using, all right? So glutathione lowers cytokines by blocking oxidizing agents that tell the white blood cells to make cytokines. So it interferes with the signal going to the white blood cells, telling them to make cytokines, all right? And then what Cytoquel or curcumin do is they get inside the white blood cells and they interrupt the factory production line, basically, all right? So you can sometimes double down on what you're doing to control cytokines. But in the end, if everything is bad, sometimes you need to pull back on how aggressive you're being, okay? All right, now, in terms of doxy and azithromycin, both of those are antibiotics that are useful at treating intracellular infections like Bartonella, okay? And they work in a similar way, but in a different way. So they both work by blocking protein production, and they block protein production in 2 different places in the protein production factory. So you can get a double blockade of germ protein production, all right? But sometimes being on both of them at the same time, because they kind of duplicate what each other does, is a bit much right away. So you might talk to your provider about maybe dropping one of those, okay? The hydroxychloroquine that they're trying to put you on can actually help manage the cytokines, but they're probably using it for a different purpose. And that is, it helps make the doxycycline and azithromycin work more strongly. And I'm not sure if that's a good idea from what you just described here right now. And secondly, some providers use it to treat what is known as the cyst form of the Lyme germ. But I will let you know there's competing evidence out there that says it makes the cyst form worse in some situations. So I don't use it, okay? All right, so when you're building a Borrelia treatment, you want to treat 3 forms of the germ. But the germ has Borrelia, which is Lyme. The germ has 3 appearances, okay? There's the corkscrew, spirochete-looking thing, all right? There's another, Lyme has another appearance where it moves inside of cells, it sheds its coat, goes inside. We call that the L form or intracellular Lyme. And then Lyme also can morph into another form, which is called a cyst form. It's a microscopic cyst form of the germ. When you're building a treatment, you want to do something that treats all 3 of these appearances at the same time, all right? Your doxy and azithromycin for Lyme will treat spirochete Lyme and will also treat the intracellular Lyme, all right? The hydroxychloroquine, some people believe it treats the cyst. I don't think it does, all right? But that's probably why your provider threw that in here, okay? The nystatin is being used to control yeast in your intestines, all right? Now, I tend not to use this kind of a treatment anymore. And the reason is I don't think hydroxychloroquine is good for cyst, right? Secondly, these days, we want to use things that will treat the different growth states of the germ as well, okay? So in addition to having these forms, these appearances, each of these forms or appearances can either be growing or hibernating, all right? And we call those hibernators persisters. And the antibiotics you're on here will all go after growing. You're not on anything at this point for persisters, and maybe your provider was going to add that in down the road, all right? So anyhow, the main thing, I think, if you're feeling miserable, reach out to your provider. You got to talk to them. And again, as a clue as to whether you're having a side effect or Herxheimer reaction, If you've got new symptoms, that probably suggests side effect. All right. If a big one is nausea, like you wrote down here, I would look first at the doxycycline as a cause for that. And one way around that is just start eating food with it, except for the dairy and dairy substitutes. Okay. All right. Good luck to you, Sheila. Hello, Vicky. Let's see. I sent 2 ticks to MedZoo for testing. I live in Southern Oregon. They tested for 25 bacteria, all of which tested negative. Is it possible that ticks would have no bacteria? Also, is there a tick season? Do they usually live in green tall grass? I've been told they don't survive dry grass and vegetation. Thanks, Dr. Ross. So they can be anywhere, unfortunately. Yeah, the ticks primarily are out beginning in the spring through the first freeze of the year, okay? And in fact, the time of the year when they probably spread most is in the early spring, and it tends to be the babies that spread most of the infections. Those are called nymphs. They're the size of a poppy seed, and you may not even see them, all right? But so first of all, they will live in tall grass. They're going to live in tall or dry grass. Remember, they're not necessarily living there. They probably just get dropped off from deer and rodents that they're on, and they're looking for the next deer or rodent to jump on, basically. Okay? All right. So just keep that in mind as well, too. Okay. And then in terms of, that's comforting to know that the test was negative, but the tick-borne testing is not perfect, all right? They can still have stuff and test negative. So just keep that in mind as well, too. Okay? All right. Good luck to you, Vicky. Hello, Catherine. See, I have Lyme with Babesia and Bart, as well as parasites. I have had surgery for cavitation of my 4 wisdom tooth sites. This was done in April. After the surgery, I seem to have a thyroid issue, hyperthyroid. TSH is 0.002, and free T3 is 5.5, and free T4 is 21. My thyroid is swollen and painful in my throat. I've been taking iodine for the past 3 to 4 years. I've stopped taking this for the past 6 weeks. I have an appointment with a specialist next week. Questions I should ask the specialist. I also have symptoms of both hyper and hypo. Thank you. All right. So, it sounds like you've got thyroiditis, which means inflammation of your thyroid. All right. And one form of thyroiditis is something called Hashimoto's thyroiditis. When you go see the specialist, in addition to these thyroid blood tests that you've had done here, they're going to want to do some thyroid antibody studies to see if you have Hashimoto's. And one of the thyroid antibodies they're going to be measuring is something called TPO, or thyroid TPO. Okay, I just call it. It's an antibody made against the thyroid, and if that's extremely high, that means that you have an autoimmune cause of your thyroiditis. All right. Now, with Hashimoto's thyroiditis, when you're really inflamed like this, you're going to have high thyroid. As the inflammation goes down, and from the antibodies attacking your thyroid, you eventually start having low thyroid. But you're not going to cycle really quickly back and forth like you described here, hyper and hypo. Predominantly, you're probably having hyper at this point, especially with the blood test that you have there, right? Now, Lyme, Babesia, and Bart can trigger autoimmune illness that will attack your thyroid. So that could be what's going on here. I'm not sure what the relationship is between the cavitation surgeries and why they would have led to thyroiditis. I'm just not sure, okay? I'm not saying it couldn't happen. I'm just not sure why that would have happened. Okay. So the big thing is if they're a good specialist, they don't need anything special. They just need to do their job, which is check for antibodies and see if you have Hashimoto's thyroiditis going on. Okay. If you have a lot of symptoms, they may choose to put you on some beta blockers to slow your heart down, to make it so you're not as jittery. Okay. And depending on what they find from their studies, that will dictate what they want to do with the treatment for you then. Okay? All right. Good luck to you. Hello, Trish. Let's see. I found interesting information about Refampin. So it messes with synthroid and vitamin D. All right. So I'll tell you, so great. What I want to let you know is Refampin has a truckload of potential side effects. All right. If you ever just Google online Refampin, what you're going to see is it's an amazing list of potential side effects. However, the reality is, in my practice, I only ever had to adjust what I was doing with Refampin by stopping it or pull somebody completely off due to side effects about 5% of the time. Even though the truckload of potential symptoms and side effects you can have with Refampin look horrid, 95% of people can take the drug and not have any problems. All right. So I want to let you know that. Okay. All right. And yes, for people with thyroid, you do need to be careful. And vitamin D possibly. All right. But I'll reflect that 95% of people don't have trouble. Okay. All right. Good luck to you, Trish. Thanks for bringing those things up. Hello, Teresa. Hold on here just a minute. Let's see here. Let's see. I have had neuroborreliosis for about 7 years, treated after 3 years to diagnosis. Only treated with a couple months of antibiotics. Further testing revealed Bartonella babesia, treated with 4 months of herbals. Lately, I've been using an online herbal plan of 12 capsules twice a day. There are no LLMDs in the area I live. I've also started using a Nicky Lyme device. I'm very tired of these symptoms. Not sure if I can expect to ever improve. Does anyone ever regain neurofunction and no more neuropathy? I have determined to restart my life no matter how bad I am feeling. I'm wondering if I should travel and pay the big bucks to see an LMD yet again. Thanks for any input. All right. So let me address a number of things here. First, I'm sorry to hear that things are as tough as they are for you. There's a group in California called LymeDisease.org that has been conducting a project called My Lyme Data over, I think, about the last 5, maybe 6 years now. It's been a number of years, all right. And basically, My Lyme Data is composed, the last time I checked, maybe about 6 or 7 months ago, I think they had 16,000 people enrolled in this. But basically, it's a database that is kept full of people that have tick-borne infections. And to sign up for My Lyme Data, you sign up. They send you an initial questionnaire and you fill out a bunch of stuff about you. And then periodically, they go back and they will query selected people from their database to get answers to some questions through questions they send out to the people. Okay. All right. So it's very much, it's called big data type project, and it is using responses from people really living with the illnesses. Okay. All right. So about, I think 4 years ago now, they did a project looking at what did it take to get people well. All right. And what they found is that a few things. Number one, using antibiotics. That was one. All right. Now, the problem is they didn't actually make a distinction about whether herbal antibiotics were part of that as well, too. So maybe herbal antibiotics. Okay. But using something that's going to kill your germs, that's an antibiotic. Their study predominantly looked at prescription, but I think herbals, antibiotics would be part of that, too. Okay. All right. All right. Number two, treating long term. And for Borrelia, that meant the people that got better in their studies, got well or very well, were all on antibiotics for at least a year or longer, right? Right. And then the third thing, and this is the point I'm going to raise with you, is the people that had the greatest chance of getting well or very well had a Lyme literate medical doctor steering their care. I know it's expensive, but this is a really tricky illness to treat. And so although I give out all kinds of advice here, I give out advice on my online education site, my intention is to inform people. And I know a lot of providers read my stuff as well too, but my intention is to educate you so you go to your providers and you get help with the things you think are going to work for you. Okay. All right. Because it's complicated. All right. So if you're trying to decide whether you want to spend the bucks because it's going to give you a better outcome. That's what the data tells us. Okay. All right. All right. Number two, in terms of can you get well, the answer is yes. I've had a number of people that had severe neurologic syndromes that as we got their tick-borne infections under control, they got, some people got 100% well. Some people got 80, 70, 80% well, but had significant improvements in quality of life and could lead a high quality of life. All right. All right. So the answer is yeah. All right. And it's going to take time, unfortunately. Again, the average length of a treatment of Borrelia Lyme is about 1 to 2 years. In Bartonella and Babesia, for 85% of people with Bartonella, it's a 4 to 6 month treatment and you're done. For 15% of people with chronic Bartonella, it becomes a chronic infection that can take 1, 2, 3 years to get under control. 15%, okay? And I'm reflecting my experience in my practice, all right? For Babesia, for about 85% of people, treating with antiparasitics that treat Babesia will work in about 4 to 5 months, 85% of the time, and you're done. But for 15% of people, this is a chronic infection that takes 1, 2, 3 years to get well, all right? So you need, yes, it's going to take time. Yes, you can get better. Find somebody to work with that understands the illness. That's going to give you the best chance of an outcome, okay? All right. Good luck to you, Teresa. Hello, Kurt. Let's see here. BPC 157. Is there any reason not to try this? I've had idiopathic neuropathy for many years and can't find anything that helps me. I have extreme heat intolerance along with major fatigue late in the day. I live in Georgia, so I can't stand up to go outside at all. Really appreciate what you're doing to help so many people. Thanks, Kurt. All right, let me see. Kurt, I think you have some other parts here as well, too. Yeah, here. I'm just going to go through these then too. My symptoms are similar to adrenal fatigue, etc., or even dysautonomia or a form of POTS. I've added more salt, etc., but feel like I can't get well. I did purchase the 2 supplements that you recommended for neuropathy and started taking them today. Just hesitant on the peptide because so many differing views on them, especially in regards to tumors. Do I need to be tested for tumors before starting? Okay. All right. So, Kurt, so in terms of, so Kurt has a type of neuropathy called idiopathic, which means the doctors haven't been able to figure out why it's happening. Okay. And that means, that may even mean they've tested for tick-borne infections and just haven't discovered that they're there. All right. So with neuropathy, it is true that about 50% of people that have neuropathy, we as a medical community are not able to identify the cause. All right. That doesn't mean there aren't things we can do, because one thing that happens in neuropathy, even if it's idiopathic, is you have mitochondrial injury, which is injury to the cell energy factories of the nerve, and therefore they cannot generate enough energy to heal. Okay. Number 2, there's usually going to be some injury to the covering of the nerves as well too. All right. So 2 parts that I like to do to try to help people repair neuropathy, regardless of the cause, regardless of whether it's Lyme, mold toxins, idiopathic. I want to repair mitochondria and I want to repair nerve membranes. All right. And so I usually like to put people on a product called ATP 360 by Research Nutritionals. ATP 360 is made up of the phospholipid fats that make up your cell membrane coverings and also the coverings of your cell energy factories called mitochondria. All right, you can repair those. All right, and in addition, ATP360 has a number of micronutrients in it that are very useful at helping with mitochondria function. Okay, all right, so that's probably one of the products you're on. Okay, the other product that I recommend is glutathione, and that is liposomal glutathione. Glutathione is a very strong antioxidant that is made inside of every one of our cells, and its job inside the cells is to repair damage. The trouble is the mitochondria doesn't make its own glutathione. It's going to steal it from your cells, or minimal amounts that it'll make. And if your cells are injured and your mitochondria are injured, they will empty the glutathione gas tank. All right, so you're on empty. You need to put more glutathione back in to start repairing the mitochondria from the inside, and also your nerve cells from the inside as well. Okay, so ATP360, think of it as fixing the covering, so it's working from the outside of mitochondria and your nerve cells. Think of the glutathione as repairing the insides. Okay, all right. Then there is this peptide called BPC-157. And BPC-157 is a peptide that naturally occurs in your stomach lining. It has been observed for over long periods of time to be quite useful at repairing tissue damage to joints, muscles, and tendons, and therefore it has a big following in the athletic community, okay? In addition, it can repair injured nerves as well, too. So it's great at fixing and healing nerve injury, okay? Joint injury, etc. And so that also is a component of my protocol. Now, I recommend using it for up to 6 months. In that time frame, I'm not worried about people developing tumors. You're not on it long enough to develop a problem. Also, the risk of tumor formation is extremely minimal. I also don't think there isn't any screening you're going to be able to do to figure out if you have a microscopic tumor hanging around somewhere, okay? So at the doses we use it, and at the length of time that it's used for, the risk of having tumors develop from it are minimal to non-existent. I didn't say zero, okay? But in terms of you're making a decision whether you're going to use it and weighing out the risk and benefits, keep that in mind, okay? All right. So there you go. Good luck to you, Kurt. Okay, so then let me just do a quick screen share here. Okay, so in terms of how do you fix neuropathy, for those of you who want to look at this a little bit more, Kurt sounds like he's following some of the ideas I have in this article called Peripheral Neuropathy Evaluation and Repair in Lyme Disease, all right? So I just want to point this out. There's some basic studies you need to do to figure out if you can identify a cause of neuropathy, okay? And so there are certain laboratories like a B6, B12, vitamin D3, blood count, kidney liver studies, thyroid, heavy metals. You know, you need to think about doing these kind of tests and look for tick-borne infections, okay? All right. And, you know, get rid of the infections or mold toxins that can be part of this. And then there's steps you can take to start repairing the nerves, all right? And so I describe all of that within this article, and I talk about this BPC 157 in particular, okay? All right. All right, let's see here. Hello, Cindy. Good evening, Dr. Ross. Could you share what you believe is the best lab for testing for Bartonella? Also, can Bartonella cause vasculitis or neuropathy? Can cytokine levels be tested? Thanks. All right. So, yes, cytokine levels can be tested, but they're unreliable. So I don't think there's a valid way of measuring cytokine levels at this point that can be reproduced and has meaning. So I don't advocate doing that. All right. So yes, Bartonella can lead to vasculitis. It can also lead to neuropathy. Those are two of the things that it can do, okay? Part of the vasculitis that it may lead to, vasculitis means inflammation of your blood vessels, everyone, is Bartonella likes to live. One of the places Bartonella likes to live is within what are called the endothelial cells that are on the inside of your blood vessels, basically. All right. So there's, so it can lead to inflammation within those endothelial cells, basically. Okay. In terms of testing for Bartonella, there's a number of labs out there right now. I can just walk you through those real quick. So one of the tests is an immunoblot method through IGeneX. And with IGeneX, that immunoblot is looking to see, has your immune system made antibodies against Bartonella? All right, so it's looking for an immune reaction. And the way that IGeneX does the study is they look to see if you have antibodies against 4 strains of the germ, in addition against the whole family of the germ. All right, so we think at this point there may be about 15 strains of Bartonella that can infect a person. And the IGeneX method actually has a way of saying, do you have any of those 15? Specifically, you can find if you have 4 of them. In addition, if you test negative for the 4, but your family, your genus test is positive, that means you got one of the other 11. Okay? All right, so that test looks to see if you have an immune reaction against the full possibility of Bartonella. All right? All right, that's one option, okay? Second option is to do a method called an ELISpot, or we also call that a T-cell reaction test, where you look to see, do your white blood cells called T cells remember attacking Bartonella? All right. And specifically the way the test is run is we take your blood, we take out your T white blood cells, put them in a test tube, we introduce proteins from Bartonella into the test tube, and then we see, do your T cells release cytokines? Okay, all right. So it's a cytokine reaction test, basically, all right. The trouble is, and that all sounds great, but the trouble is here in America, Infecto Lab, which does its Bartonella test, is only using proteins for Bartonella henselae. It's not testing you for all the other potential strains. Armin Lab, which also does an ELISpot test, is only testing against Bartonella henselae. Okay, so I would not waste your money on the ELISpot test because you're not looking to see if you have a reaction against all the strains. Okay, all right, which then leads us to a lab called Galaxy Lab. And what Galaxy is doing is they're measuring in your blood to see if you have the DNA of Bartonella in you. All right, so it's more of I would call it a direct test. All right, so the antibody and the T cell reaction are just looking to see, do you have immune reaction? If you have it, then we assume you must have the germ in you. Versus this Galaxy method, which is a way of measuring the DNA of the germ in you, is more of a direct test, because if you have the DNA in you, then you have the germ in you. Okay, all right. The problem, though, with this direct test is you got to have the germ swimming by the needle when you draw the blood. And Bartonella doesn't readily live in the blood swimming around. It likes to infect endothelial cells, and it likes living inside of cells that it infects, okay? So the problem is with a Galaxy PCR test, PCR is a way we amplify the DNA so we can see it. The problem with a Galaxy PCR test, on the one hand, it's great. They look to see if you have the DNA of all of the different strains, okay? So in that sense, it matches the IGeneX immunoblot, all right? However, we don't know how sensitive it is. Sensitivity in a testing sense means how good is it at finding an infection when it's in you? And we don't know. Galaxy has never gone out and done sensitivity studies. And I would suggest it's probably pretty low, because you got to have the germ swimming by the needle when you draw the blood. All right. Now, when you do the Galaxy test, you can do what's called a triple blood draw test. And that's their way of getting around this. We may not see it on every time we stick a needle in you. Okay. So they have you collect 3 different samples with the hope that maybe the germ will swim by the needle, but it's a hope. We don't know how sensitive it is, okay? So if you're looking to screen for all the potential strains of Bartonella that can infect you, the best bet these days is the immunoblot Thyroidgenics. Their validation studies suggest a sensitivity of about 95%, meaning it can find it if it's in you about 95% of the time. And that's strongly what I would recommend going with, okay? All right. And then you want to do test for the immunoblot for both IgM antibodies and IgG antibodies, even if you've got a long-term infection. Let me explain the differences there. IgMs are usually the antibodies you make when you have an acute infection. They're supposed to go away and then get replaced by IgGs. Once you make IgGs, we can't tell whether it's a new or an old infection. Once you make IgGs, they will stay in you even if the infection is gone. Okay. All right. In Bartonella, there have been some reports of IgM staying positive even in chronic infection. All right. So you want to test for both. You want to test for both IgMs and IgGs. Okay. All right. Good luck to you, Cindy. Hello, Irene. Let's see, dear Dr. Ross. Last time you mentioned a product that is based on earthworms for Babesia and Bartonella. Could you please specify once again what this product is and where to find it to purchase? I think it was from Candida Research, and it was called Combaluca. That's a close approximation. I'll tell you what it is here in a minute. Sorry, I think my spelling is wrong. I could not find a similar name. Another question is how to know that the Babesia Bartonella borreliosis is under control and when it's time to stop a treatment. Are there tests you would recommend? Or the decision should be based on not having symptoms? What to expect going forward? Many thanks. All right. So the to answer your first question, Babesia and Bartonella have the ability to wrap themselves in a blood-clotting protein called fibrin. And once they're wrapped in it, they sequester, hide themselves away, okay? One of my colleagues has called that fibrin nest, but basically it's germs and fibrin wrapped together, all right? So you want to break down the fibrin. And there is an enzyme made by earthworms, which is called Lumbrokinase. There are two companies that make Lumbrokinase. One is a company called Allergy Research, and another one called Candida RNA. I misspoke last time. It's actually Candida RNA. And their product is called Boluki. All right. I'm going to show you both products because I know that's a hard thing to spell. All right. Let me just shoot that here real quick, and then I'll come back and answer the second part of your question. All right, so I carry both products at my store. So if you just type in Lumbrokinase here, okay, so we have a Lumbrokinase from Allergy Research, okay, and this is 16 milligrams a pill. And then we also have Lumbrokinase from Candida RNA, and that product is called Boluki, Boluoke, okay? And this is a 20 milligram pill. To be honest with you, the 20 and the 16 both work as effectively as each other, okay? And you would want to work up to taking 2 pills a day of either one of the products. I usually have people start 1 time a day. Ideally, you would want to take it 1 twice a day, but if you can't get the timing down to take it twice a day, then take it 2 pills 1 time a day. You work up to it, okay? So to be clear, once you start breaking up these fibrin nests, you can feel worse at first, all right? So you can trigger quite a Herxheimer reaction as you uncover these things, all right? So at one time, I did start people on 1 pill twice a day of the Lumbrokinase, but boy, I was clobbering people. So I now always start with 1. And then as they tolerate that, then I'll increase up to twice a day. My preference is 1 pill twice a day, okay? The thing that makes it difficult is you need to have, you need to take it on an empty stomach. Water is okay, but you don't want to have any food or supplements in your stomach because if you do, the lumbrokinase will be used to digest food and won't be absorbed to deal with your fibrin nest, okay? And so what that means is I tell people not to have anything in their stomach beginning 1 hour before through 1 hour after taking the lumbrokinase. Again, water is okay, all right? All right. All right, then in terms of do we have, how do you know you're done? What I'm going to do, I'm going to refer you to an article because I've only got 4 minutes left here. And it's a whole article just about this. How do you know when you're done? What I'll let you know briefly is we don't have adequate testing, okay? Testing is inadequate. My article explains why I said that. So basically you're looking at, let's see. So take a look at this article called Finished and How to Prevent Relapse, okay? And I talk about cure versus remission. I talk about the fact that we don't have testing that proves that you're done. And then I talk about how I determine when it's time to stop, and it's based on symptoms, okay? And then I talk about steps you want to take to prevent relapse at first. I talk about the role and need to fix your intestinal microbiome so you get your immune system working well again after you stop all your herbal or prescription antibiotics. And I talk about how you do that by feeding it with polyphenols and probiotics and being on a good diet, and then also using probiotics or even postbiotics, okay? All right. And then taking basic steps to support your immune system, like getting sleep, like exercising, okay? So anyhow, I just walked through that quickly. Read this. It will give you all the information you need, okay? Good luck to you. All right. Try to decide. We've got 2 minutes here. Let's do this. Okay. Hi, Laura. Let's see. Hi, Dr. Ross. Do you have any comments on the efficacy of the triple dapsone protocol, methylene blue plus antibiotics, as reported in Dr. Horowitz's 8th paper published about dapsone? We respect your opinion and experience very, very much. Thank you very much. All right. So I am troubled by Dr. Horowitz and his dapsone protocol. Let me just start by saying that. So when Dr. Horowitz publishes studies about the effectiveness of his dapsone, what you have to realize is he is only using people that can tolerate taking the drugs. All right. So his first studies using just daily dapsone were published about 4 or 5 years ago now, right? And in those initial studies, what he showed is that about, I think it's 50 or 55% of people had to drop out of using dapsone at low doses, anywhere between 1,500 milligrams, because they couldn't handle the side effects. All right. So you already have basically 50% of people can't tolerate it. All right. So and then in his subsequent protocols, the double, the triple, now his quadruple, tomorrow he'll probably do an 8 times dapsone protocol. He basically starts with patients that have been able to tolerate dapsone. So when you read his protocol and it looks like people are doing great, he's inflated the numbers by at least 50% because he's already left off the group that can't tolerate the drug. Okay. All right. So I just want you to know that. Okay. Secondly, it's possible that you should call his protocol the high dose methylene blue protocol, because we know methylene blue kills Lyme and Bartonella, and maybe that's why everyone gets, if people get better, maybe that's why they're getting better. All right. All right. So anyhow, you've got to be careful with a Horowitz protocol. Basically, his protocol, if you read through it, he throws about any herb or prescription ever known to personkind that might deal with some aspect of chronic Lyme or Bartonella or Babesia at a person. He has people on 3 or 4 agents to get rid of biofilms. He has people on multiple antibiotics, as you know, okay? He has people on so many things that Who the hell knows what is going on in his protocol? All right. Then finally, Dr. Horowitz is a big evangelist for his idea. And in his studies, he's doing chart reviews that he does. All right. So the blinders are on. He believes in his stuff and he's reporting on how successful it is. So you have to know that it's subject to being overinflated. It may work. I don't know, but I'm very skeptical because of the truckload of stuff he throws at people. I know he's kind of skewed the data by not putting anyone in that failed the treatment because they couldn't tolerate it at lower doses. And I know he's a cheerleader doing his own chart reviews. All right. So I'm skeptical that in the real world, people find the results that he talks about. I'll be honest with you. Okay. All right. So there's my input on it. Good luck to you, Lauren. Thanks for your question there. All right. All right, everyone. That is, I love Dario writes, I would have died on his protocol. It's intense. It's intense stuff. Yeah. Anyhow, so that's it for me for tonight, everyone. I look forward to being here with you again next week. I'm glad for all of you that stayed this long, that you're still here. And keep your eyes out on your email tomorrow morning, somewhere between 9 and 9:30 a.m. You'll get an email from me saying that the recording is ready and it'll include a summary. It'll also give you the opportunity to sign up for next week's webinar as well, too. Okay? All right. And share that email with others you think may get benefit. And I look forward to helping those people as well, too. All right. Good night, everyone.